Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is ulna. And in case of ulna, in the previous video we have already discussed about the morphological features and the parts of the ulna. Now we will try to discuss or cover the part that is the side determination of ulna and the attachments of ulna. Okay, side determination of ulna. Minimum 3 points are required to determine any side of the ulna. And now we will consider one by one the following points. In the number 1, the trochlear notch must be directed anteriorly. Number 2, the radial notch of ulna is directed lateral side of ulna. Number 3, the styloid process is directed posteromedially. So these are the 3 points. You can consider many of the points, but you must consider at least 3 points which can define the side in which it belongs. Either it is right or it is wrong. Either it is right or it is left. So the first point, that is the trochlear notch, is directed anteriorly. Number 2, that is the radial notch of ulna is directed in the lateral side of the ulna. And number 3, that is the styloid process is directed posteromedially. Now we will try to cover the attachments of the different muscle to the ulna. Attachments of the different muscles to the ulna. Now, first on the triceps brachii. The triceps brachii is attached to the posterior surface to the olecranon process. Number 2, that is the anconeus. Anconeus is attached to the anterior surface of coronoid process. Number 3, that is the Pronator teres. And the Pronator teres is attached to the anteromedial surface of coronoid process. Number 4, that is the Flexor carpi ulnaris. And the Flexor carpi ulnaris is attached to the upper part of the body of the ulna. Number 5th, that is the Flexor digitorum superficialis. Flexor digitorum superficialis. And this muscle is attached to the lower part of anterior surface of ulna. And in the number 6, that is the Flexor digitorum profundus. It is attached to the medial surface to the body of the ulna. Number 7, that is the brachialis. Brachialis is attached to the coronoid process. Number 8, it is the extensor carpi ulnaris. That is attached to the posterior surface to the body of the ulna. So these are the some muscle which are attached to the ulna bone. Now, what are the muscle? One is triceps brachii, anconeus, the pronator teres, the flexor carpi ulnaris, flexor digitorum superficialis, flexor digitorum profundus, brachialis, and extensor carpi ulnaris. Now, the attachment the triceps brachii is attached with the posterior surface to the olecranon process. The anconeus is attached to the anterior surface of the coronoid process. The pronator teres is attached to the anterior medial surface of the coronoid process, and the flexor carpi ulnaris is attached to the upper part of the body of the ulna, and flexor digitorum superficialis is attached to the lower part of the anterior surface of ulna, and flexor digitorum profundus is attached to the medial surface to the body of the ulna, and brachialis is attached to the coronoid process, and the extensor carpi ulnaris is attached to the posterior surface to the body of the ulna. Now, there is one ligament also attachment, that is the ulnar collateral ligament, which is situated medially, and it is attached to the groove present in between head and styloid process of the ulna. Now, we will discuss the joints that are contributed by ulna bone. Now, ulna comprises first humero-ulnar joint, this joint is formed between the trochlea of humerus with the trochlear notch of ulna. Number 2, that is the superior radioulnar joint. Superior radioulnar joint, and this joint is found between the articulating circumference of head of the radius with the radial notch of ulna. Number 3, that is middle radioulnar joint. It is formed by the interosseous membrane between the medial border of radius and lateral border of ulna. Now number fourth joint, that is the inferior radio-ulnar joint, and it is formed by the head of the ulna with the notch to the medial surface to the lower end of radius. Now we will draw the schematic representation of ulna. Schematic representation of ulna. Now in the first point, that is the ulna has three parts, as it is a long bone, so the three parts are: one is upper end, one is body or shaft, one is lower end. The upper end consisting part are: number one is there are two processes. One is olecranon and one is coronoid. There are two notches, that is trochlear notch and the radial notch of the ulna. And number three, that is the ulnar tuberosity. Ulnar tuberosity. The body or shaft has three border, three surfaces: anterior border, posterior border, lateral border. Anterior surface, posterior surface, medial surface. And lower end has head and styloid process. So these are the total structure of the ulna. Now if we will give a quick summary. Now the first we have discussed about the side determination of ulna, how to determine a side, and what is the requirement to determine a side, as which bone are present in our bone in number. These bones are required to be determined by us as a perspective of a anatomist. Now side determination point must be, we have at least mention any 3 points which can determine the side. Now what are the points? That is trochlear notch, which is directed anteriorly. The radial notch of the ulna is directed lateral side of the ulna, and the styloid process is directed posterior-medially. Now we have discussed about the attachment of the different muscle to the ulna. First point, that is the triceps brachii, which is attached to the posterior surface to the olecranon process, then anconeus, then Pronator teres, then Flexor carpi ulnaris, then Flexor digitorum superficialis, then Flexor digitorum profundus, then Brachialis, and Extensor carpi ulnaris. Then we have discussed about the ulnar collateral ligament, that is attached to the groove in between the head and the styloid process of the ulna. Then we have discussed about the joints of the ulna. Number one, that is the humero-ulnar joint, which is formed between the trochlea of humerus with the trochlear notch of the ulna. Then superior radio-ulnar joint, that is between the articulating circumference of the head of the radius with the radial notch of the ulna. Then we have discussed about the medial radio-ulnar joint, that is between the interosseous membrane present between the medial border of the radius and the lateral border of the ulna. Then we have discussed about the inferior radio-ulnar joint, that is in between the head of the ulna with the notch to the medial surface to the lower end of the radius. Then we have discussed about the schematic representation of ulna. In that point, we have discussed about the upper end, body shaft, and the lower end. In case of apparent, there is two processes, the olecranon and coronoid, the two notches, that is trochlear and radial notch, and number three, that is ulnar tuberosity. Then we have discussed about the body of shaft. In case of body of shaft, there are three border and three surfaces. On the borders are anterior border, posterior border, lateral border. The surfaces are anterior surface, posterior surface, medial surface, and the lower end has the head and the styloid process. So this is the complete explanation of the ulnar bone which we have covered in the two videos. If you have any query or any doubt about related to these topics, you can comment down in the comment section. If you have any question in your mind, you can ask me anytime, and you are free to ask in the comment section. And do like, share and subscribe to my channel for supporting me and my channel, and thank you so much for watching the entire video. Thank you so much.